Hello, my name is Tiana Tran, and I am a P3 student here at the UConn School of Pharmacy. I worked on this poster under the guidance of Dr. Hernandez. So my poster focuses on the racial disparities when it comes to COVID-19 infection, hospitalization, and death rates. As of March 14th in the United States, we had over 29 million total COVID cases and over 530,000 deaths. The COVID Tracking Project reports that over 4,000 cases per 100,000 people are white people. However, Native Hawaiians, Native Americans, Black Americans, and Latino people have higher case rates than whites, as you can see with the number of cases here. Only Asian Americans have lower cases than white Americans. When it comes to death rates, we see the same pattern, with 124 deaths per 100,000 people being white people, compared to 144 Native Hawaiians, 172 Native Americans, 154 Latino Americans, and 178 Black Americans. Again, only Asian Americans have a lower death rate than white people. This chart on the right is from the CDC and displays the rate ratios of case rates, hospitalizations, and deaths compared to white non-Hispanic persons. Again, you can see all these rates are higher in comparison, besides Asian Americans. This higher rate in cases, hospitalizations, and death rates is not because people of color are more genetically predisposed to COVID-19, but rather race is related to other risk factors that impact health. To list a few key social factors that affect these numbers, one is a lack of health insurance. Just to get an idea from the 2019 census, 5.2% of white persons in the US didn't have health insurance. When we compare that percentage to people of color, we see that 9.6% of Black Americans, 6.2% of Asian Americans, and 16.7% of Hispanic and Latino Americans don't have health insurance. As a result, more people of color may hesitate to seek medical care early on and delay their health care. With medical comorbidities, a study done in Montefiore Medical Center last year found that out of their COVID patients with more than 2 medical comorbidities, Hispanic patients made up 34.3%, Black patients made up 39.5%, and white patients made up 28.9%. People of color also suffer from more medical comorbidities, perhaps as a result of a lack of health insurance and living conditions, which increases their death risk when it comes to COVID. Living conditions of people of color can affect infection rates as well. For an idea of this, the 2011 U.S. Census counted multi-generational households in the U.S. by race. 4.5% of white Americans lived in a multi-generational household, which is much lower than 9.5% of Black persons, 10.7% of Native Americans, 9.4% of Asian persons, 13% of Native Hawaiians or Pacific Islanders, and 10.3% of Latino Americans. This results in a much higher rate of transmission and higher number of cases within one household. Additionally, data on opportunities to work at home collected by the U.S. Bureau of Labor Statistics in 2018 found that out of all the workers in the U.S., nearly 30% of white Americans were able to work at home, whereas only about 20% of Black Americans and 16% of Latino Americans were able to work at home. Because people of color have less opportunities to work at home due to the nature of their careers, they have a higher chance to be infected. As a disclaimer, the numbers on my poster may have changed because COVID is rapidly developing and statistics change over time, but the trends are the most important takeaways. COVID-19 has highlighted the way a contagious respiratory disease spreads quickly. By understanding the vulnerability communities of color have, pharmacists have a unique position to combat health disparities. As pharmacists, we can help promote programs to make testing more accessible in minority communities. We can work with associations such as the National Medical Association to engage more minority physicians. We can work together with faith-based institutions in minority communities to raise awareness, debunk myths, and run educational sessions in multiple languages. As pharmacists, we should receive cultural competency training to understand these disparities. We can help train contact tracers and recruit them from within the communities they serve to build trust. Furthermore, planning for an equitable vaccine treatment so it isn't exclusively for the privileged is something pharmacists can participate in as well. The main takeaway from this is that minorities and people of color in the United States are especially vulnerable to contagious diseases, as demonstrated by COVID-19. As pharmacists, we have a unique position in that we may be working in communities where there are more people of color. We have the power to work with other healthcare officials to combat these disparities. The first step is simply being aware that these disparities exist. Thank you for your time. A special thank you to Dr. Hernandez for his guidance and Professor Wick and Joanne for all their help. And these are my references. Thank you again.